stop thinking about outreach or like our community service as something separate from our identity in the church. They all kind of go hand in hand, not just like programmatic as a new program, but like this is innate within us. This is who we are. This is what we want to be doing.
We'd like to welcome you back to the Rural Renewal Podcast. We're so glad that you are joining us today. Chris, I think we had quite a long conversation with Alan and Sidney today, so we won't talk for too long. But Chris, can you tell us a little bit about Chapel of the Snows? It's a ministry that we've had for the whole time we've been here.
Yeah. So, we started when we first moved to Southern Vermont and to where we are here in South Londonderry. One of the things that we didn't even really know about until we just about till we got here was that there is a chapel at the biggest local ski area. So we live in a place where there's 3 ski areas basically right in town, they're not all in Londonderry, but there's one in Londonderry, there's one in a town right next to us, and another one in a town right in another direction from us. Anyways, so that's what happens when you live in Southern Vermont. But the biggest ski area, which is Stanton, for anybody who is at all familiar with Northeast ski areas, when they built the ski area, they built a chapel. And the story, at least the local story, kind of goes that there was the gentleman or the family that owned a lot of the land that Stanton was built on. His name was Tink, and his wife was a very devout Catholic and very much wanted a chapel at the mountain. And so this is the story that I've at least heard. Tink was a sort of nominally Protestant Baptist because we are sort of the closest Protestant church, and he wanted the chapel, and he knew the pastor at the Baptist church pretty well. Him and the pastor who we've actually met, who was here this is in the late 60s. He knew him pretty well, and they had this vision for, we're going to build a non-denominational chapel at the mountain. So they did that. And so since then, there has been a Catholic ministry. They're a really neat Catholic ministry right at the mountain. I really appreciate the longevity of that and the people who've come and spent time there. And then there's been Protestant services at the Chapel of the Snows, which, as far as we can tell from talking to past pastors and people who've been in town forever, have just essentially never really been that successful in terms of numbers. So when we got here, that was what we had heard. That was the story we had heard about Chapel of the Snows. And so one of the things that happens, we used this phrase when we first got there, that it was a ministry. It was already kind of broken. That's a bad way maybe to put it, but it was essentially non-functional. So we were going to try stuff, and we figured we didn't have to worry too much about it because it was already non-functional. So if we tried something and it worked, then we'd have a functional ministry. And if we tried something and it didn't work, well, we'd sort of be back where we started. And we've kind of experienced a lot of that over the years. This is kind of a story of how sometimes you're going to try things. Sometimes they'll be successful for a season and then not so much. Sometimes you'll try them and they are never successful. And that's okay. And maybe we should take this advice a little bit more in what we do as churches. So before I talk forever, Kathleen, you look like you're going to say something.
Right. So for 2 years, we did a dinner church, and it was amazing. And we had made some really good connections with people who weren't going to church anywhere. And that felt really good. And then the next season, we decided that there was a whole bunch of reasons, but that God didn't want us to do the dinner church. And then the next year, it wasn't as successful. And so we've gone through phases where things have gone really well. And we've gone through phases where we don't have a ton of participation, and we only do services in the winter time. Yeah. But this season has been not the most successful season that we've had. So our thought next season is, instead of doing it just for the winter season, that we would do worship services on holiday weekends. And so I don't know if that will work, but we feel like we're building a community, and this was the first year. We always do a Christmas Eve service, and I love our Christmas Eve service up there. And we have people who come year after year.
That's the one thing that has consistently over the decades been successful. There's always been a Christmas Eve service there that a lot of people attend.
And I love it. And I love reconnecting with the people I only see once a year at that service. And this year I started asking people that I did have contact information for if they wanted to read scripture. And so we had one person that comes sometimes on Christmas Eve, read scripture. And then we opened it up and we said, we'd love to have more people read scripture. So like send us your contact information and we'd love to put you on a list. And we actually had someone, I would say in his 20s, and he said, I would love to do that. I'll send you an email. And he did. So we're making connections, but it's slow. It's so slow. And I'm excited to see what God's going to do with this. But we haven't figured it out yet. And that's okay.
Yeah. And I was just going to kind of run down the things, at least that I can remember, that we've tried up there over the years to kind of give people an idea, like, that it's okay to try stuff. And I would say, don't try stuff. One of the things we've always done up there is we haven't poured tons of resources into it, except for time. We've poured some time resources in, but we haven't poured tons of financial resources because, we're a rural church. We do not have tons of financial resources to be thrown around. And so we have mostly poured time resources in. But so when it hasn't worked, it's been okay. So when the first year, we did services early on Sunday morning. I had this mentality that as a skier, because when I skied when I was a kid, I didn't do it that often. I certainly didn't own a second home to ski at a ski community. My parents didn't even ski. So anyways, when I went to ski somewhere, especially that wasn't at like the mountain I had a season's pass at, I wanted to ski from first lift till last lift because I was just that was me. And I was mostly like a high school kid who was, of course, wanted to ski all day. That is not how people on Sundays think about skiing if you own a second home. I can guarantee you that, knowing that now, right? They think it's been a long couple of Saturday. They probably ski a lot on Saturday. They're tired because they don't ski that often. And on Sunday, they sleep in. They want to get a few runs in and then they want to get home because most of them have like a 4 or 5 hour drive. So they want to leave relatively early. So the early Sunday morning service was just not a good idea. There's not really another time. So we haven't done Sunday services since then. I guess we did do them in the afternoon for a couple of years.
We did do them in the afternoon.
We did.
That wasn't super successful either. Except for we had one person, two people.
Yeah,
we had two people that came.
Yeah.
And then we did the dinner church for a while.
And that was definitely the most successful. Part of, I think, what helped there was certainly we met some people that we didn't have connections with, but it was at a time when we talked about this a little bit in the past podcast, but our church had a fire and we didn't have a building. We were still meeting in temporary space at the time. And it was a space people we could use midweek to do some connecting with people from our church in the valley as well. And so I think that was part of the reason that worked. And then after that, we have tried kind of more Bible study kind of things on Friday afternoons. We've had a little bit of success here and there, but it's been a struggle. We're still trying to suss things out. So we're excited to try something again this year, right? We've had, like I said, all sorts of different spaces. And I think, obviously you can't always try a million different things at church. And hopefully, usually you have something at church that at least seems like it's working a little bit so that you want to not abandon that to try something new each year. But there is a space where, you can just keep trying things, celebrate the successes you've had. And we have had some successes up there. We've made connections with people, people who then moved on to be connected with other, the people that we met in the afternoons when we did that for a couple of years up there. His family eventually kind of relocated to one of the towns in the valley close by to us, and they connected with a church there. So, there was, that really was, I think, is helpful. So, feel free to be creative. And I think one of the things that we talk about in the podcast here, or in the interview that we're about to listen to, we kind of at the end, we talked about just actually one of the ways that you can measure some of the stuff that you might do to connect with your community. This wasn't so much about ministry ideas, but ways that you would connect in your community. Obviously ministry idea, but not like was, did you actually attempt it? And I loved Sidney asked that question for us. It was great. Like, did you actually try the thing? Not was it successful? Not did 50 people show up, or 100 people, or 10 people, or 2 people? No. Did you actually try to do the thing you set out to do? And that if you did, that you could celebrate that, even if you recognize after the fact, saying like, okay, we tried that thing and it didn't end up doing what we were hoping it would, so we're not going to try it again. But did we try to do it? We should celebrate even that kind of stuff. I thought that was really just a great insight into thinking about ministry.
Yes. And we interviewed Alan Stanton he was on season 1, episode 1. And we also added Sidney Everhart to the conversation. And I thought the conversation just kept getting better and better throughout. And so it was really great to to get some ideas about how our churches can partner with organizations locally to support the health needs in our community, and how it can strengthen both the community and strengthen the church as well. And so without further ado, we're going to listen to our interview with them. Today on the podcast, we have Alan Stanton and Sidney Everhart joining us. Alan, can you tell us a little bit about yourself?
Sure. So I am ordained in the Western North Carolina Annual Conference. I grew up in Eastern North Carolina in a small rural town, and my whole career really has been about supporting rural communities and rural churches. And so that path has led me on kind of a winding road, which happens in our vocations as we follow God, right? Stuff I never expected to be. But I've served in rural church as a pastor. I've been working in a think tank before. I worked as a director of a center that did rural and economic development with faith communities. And now I manage a large statewide initiative to expand access to dental care in rural Tennessee, as well as I hold an appointment at a small Presbyterian college in Arkansas, the University of the Ozarks, where I work on their Thriving in Rural Ministry initiatives, teaching other pastors and working with small churches and just kind of acting as a think partner. So it's great to be here. Thanks for having me.
If you listened to season 1, Alan was our very first person on the podcast. So if you want to go back, episode 1 of season 1, we did a whole interview with him. But we decided we wanted to add to the fun today. So we also have Sidney here. Sidney, can you tell us a little bit about yourself?
Sure. Thank you. My name's Sidney Everhart. I am currently serving as a layperson in the Missouri Annual Conference in the Office of Mission Service and Justice. So my title is Community Engagement Specialist. I grew up in Northwest Missouri, and I've lived in the Columbia area for a little more than 10 years now. And my formal education background is actually in public health promotion and policy, and had an opportunity in grad school to work at the conference part-time with an ecumenical ministry called Festival of Sharing. And so then once I was getting ready to graduate from grad school, there was discussion around how can I stay on full-time and be more involved in the conference. And so added in some responsibilities that work and focus on kind of rural ministry. And so that has varied over the years what that looks like, but it's been a lot of encouraging churches to work in their communities and learn about their communities and get involved kind of with that perspective of mission, service, and justice.
Great. So Sidney, we're just going to get right into the questions today. You have written, there is no formula for creating a thriving rural church, but there are practices and tools for engagement that promote the health and growth of a congregation, which is relevant to its context. Can you unpack that for us? And how can congregations use that mindset to approach healthcare in their communities?
Sure. Yeah. So I think part of it is kind of thinking about and reflecting on what does thriving mean in your context, and really opening that up to be beyond numbers. For my role, that's what's exciting, is when we get to talk about the narratives behind things and go beyond just the numbers. And so thinking about that, and then identifying assets in your people, in your resources, your building, your community, and going through a little bit of that. Taking stock of what's going on around you, and using that then to think about your mission, vision, and values. So I think churches who have a clear path and idea of who they are and how they want to be in their community and their context, and then they're thinking through their strengths and their assets and how they're actually carrying those out in your action steps. And then one of the things that we talk about is like setting some SMART goals, making sure they're measurable and attainable and relative to what you're doing, and kind of setting yourself up to have a plan in mind is, an opportunity to be a thriving congregation.
Yeah, it's I think so helpful to see the ways to think creatively about the different ways that that God might use what you have as a congregation to address some of the needs, to kind of work towards making sure that your community looks a little more like the kingdom of God, and that we're always working towards that. And I think it's really neat to hear what y'all have done in terms of helping congregations see that happen in their midst. I think I know for my context in the rural churches and the smaller membership churches that I've known over the years, it can get easy to start to see the needs and like kind of the lack of what we have. But oftentimes it just takes a slightly different set of eyes to be able to say, no, you actually have these resources that you could tap that would really be a blessing to what God could do with you do for you as a congregation.
So we've been talking about assessment, but how can churches assess health needs in their communities and use assessments to identify strengths and skills of people in our churches to meet those needs?
I think there are a variety of ways to assess health needs. I think from the church perspective, you may not need to be the one who does the assessing per se. There might be an agency who, is equipped to do that work already. So thinking about, like in my context in Missouri, we have like local public health departments in most counties. Maybe you've got a city planning committee. In Missouri, we also have the University of Missouri extension offices in every city. So they've kind of got the funding and all the tools to do some of the actual like data pulling, some of the support behind things. And you might even think about like school districts. They might have information about at least their own students, if nothing else. And I would say kind of reach out and start connecting with some of those types of organizations and seeing what information they can teach you all about. What are maybe the top 3 things in your county or your region or your zip code, whatever it is that makes sense for your context, and say, what are kind of our top health needs? And that kind of maybe narrows it down, because when you're thinking about public health, the part that has always interested me about public health is it's so broad and expansive and includes so many things. But for other folks who maybe that might seem overwhelming, it's a lot. So it could be overwhelming to think about all the different things that are going into the health of our daily lives. And so just saying, hey, like, can you tell us 3 things that might be a need in our area? And then kind of work from there. Also for us in Missouri, which some other folks in other states might have something like a Mission Insight. It's kind of a database that pulls from a variety of other data sources and allows us to kind of set some boundaries and look at demographics and tendencies and motivations of populations. And then you can kind of take that information and go, okay, here's what we've learned. What skills do we have? And maybe you've done some of that kind of internal skill mapping of your people or your resources, and then think about kind of where they're overlapping and kind of move forward in that direction.
Can you give us like an example or like a story of a church doing this, just so that we can get a better sense of what you're talking about?
Yeah. So the church that I'm thinking of really embodies that mindset of like, we want to be a community resource and we want our building to be available. It's a large open country church, and it's about 20 to 30 minutes from any of the larger communities in neighboring counties. And so actually the pastor who is currently there was previously in kind of the healthcare world, so kind of knows that there are there are places that access to resources is limited or different or what might kind of along those lines. And so the church building has a really good facility. And so during the week, there's not many people in there utilizing all the different spaces. And so there was an opportunity that came up to partner with a mental health provider, like in a neighboring county. And so they were able to pull from, their existing asset of a building that's open all throughout the week and has different rooms to build a relationship with this provider, and they set up a telehealth room basically. And of course, they went through all of the necessary kind of protective measures of setting up some legal documents and some building use policies and things like that to make sure that it remained a safe place for people. But basically, they've got a room now that community members can come into to telehealth into their mental health counseling sessions. And so what I especially love about this is that they talk about it. They talk about it during church. They bring it up. You know, it's a resource for the congregation, but also the community at large. And they recognize that and celebrate that. And I think that takes it a step further of like, you're doing something, but then you're also talking about it and you're making sure folks know that it's there and that it's available. And I just really admire the work that they've done through that outreach.
Yeah, that's a really neat idea. Without asking too many questions about the church, how did they, was there, I would imagine, as much as that's a fun idea to get behind, I would also imagine that, you know, for letting people come in and use your space for something like that is a hurdle sometimes for congregations. Did you help them work through that at all? Or is that something their pastor worked with them through, or?
That's a great question. I didn't work through them on that particular piece. I think the pastor who is there, who's been guiding them through this process, had the leadership skills to navigate that conversation. And especially like they put those safeguards in place of kind of the building policies and the expectations. And I think that really set them up to be successful in that situation. And then, you know, acknowledging there's probably something innate about this congregation that makes this type of ministry outreach work, you know, that they're understanding of their position in the county and their, you know, opportunity to partner to do something kind of beyond what they're already doing. So
that's great. I like that they celebrate it too. Because sometimes I think we don't always do a great. I mean, we're not out there necessarily trying to be self-promoting always about the things that we're doing for the Lord, both on a personal level and on a church level. But at the same time, it's particularly amongst one another. I think it's really important to encourage as a faith community, you know, as a group of brothers and sisters. Hey, this is part of what we feel like God is calling us to do. This is how part of the practical way that we're living that out. And that is, it's a good, not just good, but it's appropriate to celebrate that internally, certainly, and talk about it.
So Alan, we don't want to forget about you. How can the church foster an attitude of community outreach?
I mean, you can forget about me. I think Sidney's done a great job of answering the question. So, yeah, and I think that's a hard one for a lot of churches because most churches I talk to want to be doing something in the community, right? And I get a sense sometimes that a lot of these churches are already sort of overwhelmed by everything that they're already doing. So, and part of that's just the way that people engage in small membership churches or rural churches, right? If you go to a large membership church, you're kind of expected to be part of the programming, to volunteer in programming. In smaller churches, you're really taking on a lot of kind of administrative organizational task, right? So when you start talking about like, okay, let's launch another program, people start kind of saying like, I would love to do that. And also I'm feeling burnt out, right? I mean, I get it. Like I'm a dad, I have 2 kids. When I get home from work, I'm tired and I, you know, I'm sitting there going like, do I really want to go to another meeting tonight? So on the one thing, I think one thing I want to start with churches on is taking a step back and thinking about outreach, not as like another program, but as sort of a natural extension to what you're already doing. And an activity I like to do with churches is really go through and look at where are your people in the congregation already involved in the life of the community, right? So most churches, I'm working with a church right now about an hour away from here in Arkansas, and we were doing this activity and, you know, you have 2 doctors in the churches that are doing free physicals for all the kids in the community, right? There's one big high school there in that county. They do all the physicals for all the sports. You have people that I think there's a physical therapist that likes to work with special needs children, right? And they volunteer on these nonprofits that are doing these things. You have people that are working with United Way. You have people, so you have people that are already involved. And so I think one of the places that churches really can start is by cataloging those places where they're already involved in the community. And like y'all were saying a minute ago, like kind of celebrating that, saying like, look at what our congregation and its members do. And that shouldn't really be that much of a leap. I mean, a lot of denominations, we were making a joke one time in this meeting where like one of the other denominations, when their congregants are on a board in the community, they're there both as like their individual selves, but also they make it very clear they're representing whatever church they're part of, right? It was like, I think it was the Pentecostal church. They were like, they're there as members of the Pentecostal church. And so, stop thinking about outreach or like our community service as something separate from our identity in the church. They all kind of go hand in hand. And I think that's one of the ways that we can start steering people to think about outreach, not just like programmatic as a new program, but like this is innate within us. This is who we are. This is what we want to be doing.
Yeah, I like the piece there about celebrating that, and that people think about the things that they're doing outside that they're probably already doing as something they're doing as part of the church, and that they are in some ways representing and bringing the church into those spaces, kind of incarnating it in those spaces. I know one of the things that's nice is to recognize. You both kind of talked about how important it is to recognize what's already kind of going on and finding a way to partner with some of those organizations. That's one of the way to make sure that you're not entirely responsible for some of that administrative and just logistical kind of stuff. That how much nicer is it when you can just show up and in some sense volunteer, spend your time doing some of the stuff that you feel like God is calling you to do instead of having to organize it if somebody's already doing that. I mean, obviously if none of it's happening, then maybe you need to be the organizing force. But if it's already happening somewhere, how can we as a church find ways in our community to help partner with those things? And in most, even in small communities, usually there's at least some version of a lot of this kind of stuff is happening in some ways. And so, yeah, that's really helpful.
And one of the cool things is like when you take a small step in that direction, right? Like say, using this example of like two doctors that do physicals for the community, right? It can start off as something really small like that they're already doing. And like you have a couple church people show up to help kind of make sure everybody's in the right line and kind of expedite the process. And then it turns into something over time that's much bigger and it kind of ripples out from there, right? Those sort of like taking a small step or like partnering with another organization that somebody in your church already works with can really ripple out into new creative ideas.
I like that. And I think, or my question then is like, how can the church support initiatives that are already happening? So for example, you've been working on expanding access to dental care in Tennessee. Like how does the church kind of join in? Because the church doesn't necessarily want to take over, but they also don't want to, they want to be a support, not actually make more work for the organization.
Yeah. So we don't want churches to necessarily take over everything. Like I work in a college of dentistry. We operate clinics throughout the state, right? That's something, there are church run clinics where they hire the dentists and the dentists kind of volunteer their time. For our purposes, that wouldn't necessarily work because we have to have like credentialing and accreditation and like all these different, hire faculty, right? Those are things that as an educational institution, like we have to be responsible for. But one of the things I really rely on churches to do is, as we're going out into Tennessee to like build clinics, I need churches to help me connect to the community, right? I mean, that's a huge thing that churches do for me. And when I go to a community, one of the things I'd like to do is sit down with the pastor of whatever church is there and say, like, who should I be talking to in this town, right? Who in your church would be a good resource for me to talk to? Because like, to build something like we're building in all these communities is not something like we don't have state dollars to do all of it. We're relying on like partnerships and federally qualified health centers, FQHCs, hospitals, other dentists in the community. Like if you're going in cold, you can try to find those, I guess, on like LinkedIn or Facebook or something. But the best way to do it really is through a church and through the networks of the church. But then there are smaller things like when I was in my last position in a small town, I was really close to the CEO of the hospital. And we were talking a lot about like, how can churches support COVID, right? And so the hospital, like the healthcare workers in COVID. And what we sort of found was like, there's some data-driven things that churches kind of do that they could be more intentional about doing. So like in healthcare in particular, like one is preventative care, right? Like just making sure that people are getting good preventative care. And maybe that's adjusting your diets in church, right? Not everything has to be deep fried, right? In the potluck. Sometimes it's like a walking group. so just the kind of like preventative care things. One is helping people get to the right doctor at the right time. So it's helping people get to their primary care providers. And churches kind of already do this, right? If you need a ride somewhere, like you're probably going to ask somebody in your church. So being more intentional about that and having like volunteers specifically to do that, to get people into these healthcare kind of things. And then the last one that we found was really important is just helping patients be compliant, right? It doesn't take a lot of effort to call somebody and say, hey, did you take your medicine today? And I've seen that, like my grandma, when she was alive, she had a friend that did that to her every day, right? Like, hey, Jean, you need to call and take your pills, right? And so these are really like things that we are already doing that we could sort of be more intentional about doing in a lot of these churches that are very natural to the DNA of what we do as small membership rural churches. And they would go a long way to supporting like the existing sort of health infrastructure in the community, I think. And Sidney, I mean, you have a master's in this, so you might actually disagree or say more than I could, but because you're an actual expert.
No, I think what you're saying is a really great example and really kind of breaks it down to some practical steps and an approach to thinking about what is existing, what's our strengths already, and, you know, the social relationships that we have through our churches and then within our community. Helps you to know a little bit more about what kind of is going on in some folks' lives. You know, there are some people out there that might be struggling to get to the doctor if you're in a more rural place. And so you might have to kind of find out a little bit how to reach those folks if they're not the ones that are in your congregation. But yeah, definitely in your thinking about in your own connections, the ways that you can support that.
Yeah, I know that's a good point about like just helping people get where they need to go. That's one of the realities. We have a small clinic in town, but if you've got to go for anything beyond just kind of general like blood work or something, like if you need to go for anybody who's got any kind of cancer treatment or any like thing like that in town, you're almost an hour drive minimum, maybe an hour and a half, depending on where you're going. And there is a local social services agency in town that does a lot of rides. They have a rideshare program, but I think both churches in town certainly help with that and sort of, you know, and there's always like gaps in that kind of thing too. And I think, you know, finding ways to partner with them, they're probably willing to kind of help let you know when they need a spot, right? Because their rides are somewhat limited, so sometimes they can't fill all the gaps. So, yeah.
And then sort of on that, like, I mean, it flows the opposite way, right? Like, I rely on churches to help me understand the community better and to find those resources. Sometimes the churches are the best place for the people who need the services to also connect to the services. So, I mean, there's a wealth of like nonprofits and health departments and people don't always know what they offer, and the church can kind of be the place that connects them back. The church is like a connector is a big thing that I think that we need to remember in rural places in particular.
Yeah, that's a really good point. Yeah, because I can think of many times where someone comes to me and they're like, "What do I do?" And I'm like, "Well, we don't really have anything fully for you, but I can send you neighborhood connections, and they have the answers to those kind of questions for you." So, yeah, it's a really good point.
Sidney, how can our churches partner with local organizations to address the social deterrents of health affecting our communities?
Yeah. So those social determinants are kind of those environmental factors that we're like born into, we live, we work in, we play in every day, we worship in. So you're thinking about like not only just like your income and your housing, but are there safe playgrounds, safe sidewalks? Are you able to access a grocery store and food and kind of what all those different pieces look like? And these can be impacted on a variety of ways. So I think it kind of still relates back to finding out where your strengths and abilities are as a connection, as a church, as a congregation, and where those overlap with some of the health concerns. So maybe you've reached out to a local agency and they've said, you know, oh, we see that there are a lot of elderly folks in our community who live in single family homes. And so you're thinking, okay, these people might be living alone and they might be susceptible to things like social isolation and depression. And so, you know, what's something that we can do? Okay, we've got, you know, a lot of retired people who are free throughout the week for, you know, various amounts of times. And maybe they're going around and just saying hi to these people and making sure they're okay, or, you know, kind of checking in a little bit and making that social connection. And so They might find that out, like I said, through a local agency. Maybe that's the health department. Maybe there's a senior center. Maybe if you have kind of like a city planning team or a kind of group that kind of comes together, they might have some of that information, but really thinking about the folks who are in proximity with these people, and then taking that approach of listening and hearing what the organization says that they see going on with this population, and then what they would recommend as a safe and effective way to interact with them, because they're kind of the experts and they have the abilities, and so they're gonna have the experience to tell you what's going to be the best way to partner with them to serve that population or that need.
Yeah, I really appreciate the sense at which you really encourage us to really find partnerships and to listen, to find the spots in this where we can be essentially be the support there that kind of makes things go, whether that's being whether that's directing people to the resources that are already there or filling in the gaps. I think those are questions that we sometimes, as rural churches, small membership churches, we get overwhelmed and forget to ask and find these simple ways that, in many ways, you probably already are doing, but how we can do it in just a half turn towards a little bit more strategic about it, and it can really make a huge difference. And I appreciate that you all, both of you, kind of have worked in that space to kind of help us as in rural churches see what are the ways we could just take a little bit more advantage of the stuff that God's already calling us to do. I think it's really helpful.
And going back a little bit to, there was a previous question about kind of some examples of churches making partnerships. And that also got me thinking about things almost that are kind of connect to that issue of maybe location and distance between things. We've seen some churches who doing kind of basic partnerships with like some mobile type health resources, like the mammogram vans or the veterans mental health vans that really kind of need a safe location to park and set up for the day so people can come to their mobile unit and get checked out or, get connected to the broader resources. And so that's kind of like, a pretty easy ask of people to be a spot, if you've got a parking lot and or maybe, like a bathroom facility that they can use, kind of those sorts of things. I think those are pretty good examples of a way to support an extension of a healthcare item in a rural place.
I'm going to tag on to that because she makes a really good point. Like during COVID-19, when vaccines were coming out, right? And there was this whole kind of like, how do we get vaccines to rural places? And there was a lot of questions about because at least in the county I lived in, right, you had to drive into the county, which depending on where you were in the county may or may not be a possibility at any given moment, right? You could drive in, you could get it. So what we started doing was the college got a grant to do pop-up clinics throughout the county. And the two places where we could really access the population outside of like work hours, right? The grocery store and churches. Mm-hmm. And we found that people who might have been reluctant to get a vaccine, because you remember this is kind of like politicized, right? If their pastor encouraged them to, or if it was like available as part of their church, because they trusted their church, they were more likely to trust the people that were giving the vaccines. And so we were more likely to get people to come into our kind of church lines that we were doing in church parking lots. It became a really great partnership with the health department, right? Just to get vaccines into the community through churches.
Yeah, that's a really good point. And I think, finding those places. I was thinking about around here, a lot of churches do, Red Cross uses a lot of churches to do blood drives. It's a space that's oftentimes not used during the week, at least that much. And, like, because schools often can do that kind of stuff, but obviously during the school year that gets complicated and there's, but church is often a great place to do that. I was trying to think around here. I think both the two that we would potentially go to, both are usually in churches.
I would say probably 75% of the locations that you can donate blood in Southern Vermont are church buildings.
Yeah. There was a whole plan at one point to say, like, could we get, this was actually talked about at the federal government, right? Could we use Dollar General to get out into the community, right? And like, I have nothing against Dollar General. The foundation I worked at before was like funded in part from Dollar General. Like, I don't have anything, but like, I trust the church more than I trust Dollar General. I'm more likely to like stop at something that's happening at a church than I am to stop at something that's happening in a Dollar General parking lot. Like, I go to Dollar General and I need diapers at the last minute.
Did you really want to use the bathroom facilities at a Dollar General versus a church?
Right. And it's kind of like with a needle, right? I mean, like I'm sitting in a parking lot with a needle outside of Dollar General. Like, do you want me to give you a shot? Like, probably not. At the church, like, I know you.
No, that's a really good point. That's a really good point.
Yeah, like, and I hadn't thought about, our buildings are definitely an asset, especially in a rural community, because there's not a lot of bigger buildings in a lot of communities. But I never really thought about how a church can be a comfortable place for people in the community to go to, that they might feel a little bit less nervous. I think a lot of people, if they're getting a vaccine, they're already feeling kind of on edge, whether or not they're verbalizing it or not. And so if they're like, oh, I feel at home at the church, they're probably feeling more comfortable than Dollar General, because that's just a store, right?
Right.
Yeah, and I would say
I'm going to be in trouble.
Well, we have nothing against Dollar General either. So could have been any store, but it definitely. We probably underestimate, especially in rural communities. Churches still have that sense of establishment, even if it's a place where not that many people in your community on a percentage basis go to your church, or you're in a pretty certainly in Southern Vermont, we're in a relatively unchurched area, but people still have a sense that the church is a place, for the most part, that there's some safety in that spot, even if it's not a place that they feel that they spend a lot of time in. They've probably been to funerals at your church, or they've been to weddings, or they've been to other things, and the space seems familiar and safe. And so that's a really good point in terms of, because healthcare is always, you're always feeling a little nervous about that kind of stuff. So,
we saw that with mental health a lot. So I think it was the Duke Endowment that did this in North Carolina, where they would actually help churches purchase like telehealth machines back before Zoom was a thing. Because in a small town or a rural area, either you have to drive quite a ways to get your mental health care, or it's in a very public location, right? Because I don't know about y'all, but when I would drive through my small town and I would pass like even the dentist office, I'd be like, oh, that's Joe's car. And so people, when there's a stigma around like mental health care, people are like, oh, I don't necessarily want to be seen parking there. No one questions when you're at the church, right? So they would set up like telehealth in a church, and you could go in, do your counseling, and head out, and no one is going to think twice about that. So people just felt more comfortable going to that location. Yeah,
that's a really neat idea, and I think it's stuff that ways that we can leverage the stuff that God has provided us with, the spaces and the buildings and things like that really can make a difference in people's lives. That we, I think. Just little ideas like that are just so neat to hear about how God is using some of those spaces. So it's really cool.
And there are some approaches that I've seen as well that, kind of if the church is acting as like the telehealth side, or like a satellite location for services that are provided by kind of like those experts in the field, but then the church couples that with a necessity type ministry of their own. So the one I'm thinking of, like there was some women's health providers who were using some space in a church, and this was a set up partnership. They had the safeguards, they had kind of the building usage, like all those really good policies that you want to have in place. And then the church itself had an existing kind of diaper bank, kind of baby grace type ministry. And so, if women were in the building receiving care from the providers, but then they also needed something that day, they were able to, because that ministry was also existing in the same place. So then you've got a little bit of that wraparound type, opportunities where you're fulfilling an immediate need for physical type health, and then you're also helping empower people by having a provider there at the same time.
Yeah, and that kind of stuff provides just so much connection point in terms of actually helping connect people beyond just to the physical needs that they need. But it's, it's those relationship points where you get an opportunity to hear what's going on in people's lives and see, is there a place where we can meet some spiritual need here as well, even if that's in an appropriate way for the setting, right? I feel like one of the things that our both churches in our town, we kind of partner on a food pantry. And one of the things I love about the way that we just happened to, and this is long, they've been doing this long before I ever moved to the community, but mostly because of the logistics of the situation, we bring stuff out to people's vehicles as they're continuing to grab more bags of stuff. Being able to just do that week after week, you do get to hear and have that's mostly we're there to provide food for people, but over time you get to hear stories and you get to know what's going on in people's lives, what some of their healthcare needs are, what some of the spiritual needs are in their lives, and it's an opportunity simply to provide that in the moment, but also to continue those relationships. And that's how one of the ways in which people find their way to being connected, not just with the things that you can provide. That's really important and really helpful if that's all they ever get out of the relationship, but more so the opportunity to sometimes connect as part of the wider community of your church and be connected with their spiritual needs and with Jesus as well.
And something you touched on a little bit that we hadn't kind of talked about yet was partnering with other churches as well, which sometimes looks different in a rural context if you're farther apart. But I think in this work, and then in any other work, if there's a chance to partner with another church in the area to do so, I mean, you might as well pull your strengths and your resources together. You don't necessarily have to do this alone, and that if the community sees you all working together, if you want to create a safe playground for people to, be active and physically putting, into their physical health, then you're working together. People in the community are going to recognize that and see that, you care about them and you care about their health and wellness of the surrounding area.
Yeah, that's a really helpful point. And I think it can be a challenge. It's in a small town. It's you just have to find ways to do that, to partner, right? I know. I think we often see each other. We get way caught up in this American model of seeing each other as competing forces somehow. And just in the kingdom of God, that's just not how reality should work, right? We are not. We are working towards the same goals, even if we don't. I mean, that does, and I think we can do that even amongst churches that we have maybe significant disagreements with about how to approach certain theological topics and things like that. We can still find ways to work towards the wider kingdom values that Jesus is talking about in terms of making our communities a better place where people really thrive. So, yeah, definitely.
Alan, I have a question for you now. You once wrote this: churches are places where people from across job sectors with varying backgrounds and opinions all come together for the common purpose of serving Christ. This presents an amazing opportunity for the rural church to engage and strengthen the wider community, which in turn strengthens the church. Can you talk about the church strengthening community, but then also that strengthens the church?
Yeah, I think the biggest thing in that is, let's a couple things really. One, I think that we just don't always recognize our talent within our church, right? And I think this goes back to how we think about the church and our vocation and all these kind of things that happen out there, right? So, I was working at this church a couple months ago, and we were going through and talking about all the talents that are kind of within the church. And somebody said, I don't really have any talents, and I don't really have any skills. So I required them that they, like, the requirement to complete the program is they had to write, like, that activity was that they had to write down 3 talents that they had. And she comes out and she's like, yeah, I'm a movie buff, right? And I used to host these like movie nights for the community. And people sometimes like forget that you can bring these things into the church. So one is just kind of helping to recognize, like, you are created, you have passions, you have talents, like, and all those things are valuable. You don't shed who you are when you walk through the doors of the church. And the same is true with our jobs. Not everyone has been lucky enough to like pick a job that they really love and do it every day. And so I totally get that. But for those of us who kind of got to choose, had the privilege of choosing what we wanted to pursue in life, those are skills and interests that we get to bring into the church, and we shouldn't abandon those when we walk through the doors on Sunday morning. So part of that's just kind of understanding like who we are in fullness. And when you start doing that, you really start piecing together kind of cool things that can happen in the community, without trying to like overthink it or trying to like, engineer some grand program. Like, you have this talent, I have this talent, let's just put it together and see what happens. Mm-hmm. So that's like, strengthening the people in the church and strengthening the church. But then I also think as you go out into the community, I think that continues to build trust for the church, particularly if the church can really articulate, like, this is who we are because of Christ, right? Like, this is who we are in the kingdom of God. And we are trying to help reveal the kingdom of God around us. We're inviting you to participate in the kingdom of God because we can articulate that as a congregation, because we can help build up the wider community. The rest of the community is going to start being able to understand why you're doing what you're doing. And that's going to add more trust. And I don't think it's controversial to say right now that like we're a society without a lot of trust. And so building up that trust in the community and building up that trust for the church, I think that that's a good thing for us, that like we still need trust in the wider community for the wider community to like come into our doors and know the joy of being part of this community. So that's how I would say that. Sidney, do you have any deep thoughts that might be better than that?
Well, I don't know if it's a deep thought, but it made me think of this like practical activity that I like to use when I'm working with new groups of people, because I love learning about people and what they do outside of like who they are in that moment. It's from I learned about it through the neighboring movement, which is out of Kansas. It's called the gifts of the head, hands, heart, and spirit, I think. And so it's like basically like a piece of paper, and you write down, and this helps break it apart for people, so it's not overwhelming to think about like, what am I good at? Because like you said, like when you get in there, you forget who you are. But so it's like, what's something you're knowledgeable about that you could teach someone? What is something that you do with your hands that you could show someone? And kind of breaks it down into some of those other pieces. And I have seen some really cool conversations come out of this where people didn't know that, the person sitting next to them liked, to do gardening, and they both like to go do gardening. And so that was like, they connected on that, and so it's kind of like little things like that spark really good conversation that then leads to something a little bit deeper as well. So I just kind of thought of that when you were talking about that.
No, that's awesome. We do a similar thing. And like when I work with church cohorts of pastors, where we'll take them and they have to, it's an asset-based community development exercise, right? Where we'll say, you have kind of the head, hands, heart thing. And I'll give them like 2 minutes to write those things down for themselves. And then we'll put them in groups of 3. And it'd be like, you have to use one from each person's category. And you have 5 minutes to come up with an initiative to do something, right? Yeah. And you come up with people come up with some really creative things in that moment. And they're like, oh, I can never, I'm not good at anything. And I think like one time was somebody really was good at the piano. And so they came up with this idea for like a music camp, just like in 5 minutes. So they had like structured it out. So like all 3 of their talents and gifts and passions have been utilized. Right. And so it doesn't have to be like super hard, but you do have to really be able to think about those things and name them. And the church should be helping people to do that.
Yeah, and I was just thinking as we were talking about this, that this is one of the things that just having a Sunday service where all you do is not helpful with, right? I mean, there's nothing wrong with coming and singing and listening to the word and hearing it preached, but there is a sense that we have to find ways, and I think people in small churches know this, right? We gather and eat at the very least, right, and talk about the kinds of things and have these conversations where we recognize the value and the skills that other people have and bring them together. And not be afraid to just imagine what could be possible with the people that we have. And doesn't mean that every idea ends up, you hit a home run with. That's okay. But it does mean that, we are constantly trying to think of what are the skills God has given us, when he brings us together as people, and how can we use them. So yeah, really, really helpful.
I have another question for Cindy, if that's okay. I'm breaking the podcast rules, but so we're talking about like these sort of initiatives and partnerships, and you mentioned early on the SMART goals. I'm just curious, like particularly when it gets to the measurableness of it. I've seen some churches kind of struggle with like, how do we measure this? I'm just curious, like how you approach that and help churches through that, because I'm curious, so that I'm asking to learn from you and mooch off of you. So.
Well, that's a good question. And actually, this weekend we have a small membership church cohort, and it's the second part of their in-person trainings. So it's actually happening this weekend that we're going to be working through this. So if this was Monday, I'd have a little bit better answer if how it works in practicality. But I would have to say it probably goes back to just thinking about really reflecting on the context and like what you've identified as your mission, vision, values, and so then what makes sense for the church to measure, and programming our minds to think that it's not just numbers, which is really, really hard. Because if you're a part of a bigger connection, so like in the Methodist world, you're a part of a conference, and part of being in that conference, you have to turn in numbers and reports and things like that. And so whenever I go work with people, I'm like, remember, your numbers don't necessarily matter to my role. Of course, I love to hear that you're doing that, but like, it's not a make or break for me. It's like, what did you learn? And so maybe that's a way to approach the measurement piece of like, what do they want to learn? And then kind of work from there to craft that measurement. But I don't know if that's helpful or not.
Yeah, that's really helpful.
I was going to say, I think that's helpful. And I think for the most part, we don't really respond to numbers anyway. I mean, they're just that, they're numbers, right? Like anytime I've heard of something and I've been like, oh, that's a really amazing idea that I can tell that they've really done some great stuff. You hear the story about what's happened. And that story is often one or two individuals that are obviously represented in a bigger number, maybe, and it's okay to do some numbers. But the way that I think the way that we really do this is we find those. What are the stories behind what we've actually seen happen? If we're doing some sort of healthcare thing, who gained access to the healthcare that we were offering because who wouldn't have, and what would their story have been if they didn't, if they weren't able to do that because of what we're doing? And I think definitely the numbers are important, but ultimately I think it's the stories that kind of help us move forward a lot of times with that kind of stuff. So,
right. And I think, a basic measure could also be like, did you do it? Did you try it? Because, if we're thinking about these initiatives that might be kind of scary or intimidating or overwhelming, I think a good measure of like if a church actually tried it, and even if they don't feel like they succeeded by the terms of the goal they've outlined, they've still like learned something. So, it kind of goes again. Well, I guess it goes back to the learning piece of, did you do it and what did you learn?
One of the things that I've been thinking a lot about recently, and this is because I work in a higher ed situation, right, where we're doing our strategic planning for accreditation. And one of the questions was like, is this a goal to move us further along, or is this a goal to like build infrastructure, right? So like one of them was we need to go through and redo our data about statewide community needs. And so the question when it came up was like, how are you going to measure this? And I was like, does it exist, right? Like at the end of the year, does this spreadsheet exist with all the data? And it was infrastructure. And I think like to Sidney's point, like, yeah, those kind of things, like, did you do it? Like, do you even have the infrastructure to do it? Right. Like, did you build some of that? That's really great.
Well, this has been a great conversation, and we appreciate you taking the time out to talk with us. And it's given me a lot of ideas on things that we can do at our church. But I think that it can help other pastors and other people in churches, encourage them to think a little bit outside of the box and get creative on how they can help their communities. So thank you again for coming today, and we hope you have a great day. Rule of Renewal podcast is brought to you by Fresh Expressions and the Ascent Movement. Fresh Expressions is a worldwide movement of everyday missionaries who want to see churches thrive in the places we live, eat, work, and play by leveraging the creativity and endurance of the inherited church. To learn a simple 5-phase process for starting a new expression of church that works in small towns, big cities, and everywhere in between, go to freshexpressions.com/how-to-start.
To connect with this podcast, you can email us at podcasts@freshexpressions.com. Rural Renewal Podcast is hosted by Kathleen Blackie and Chris Blackie. It's edited by Joel Limbowen and produced by Kathleen Blackie and Chris Morton. Our senior director is Dr. Christopher Backert.
If you have learned something or been encouraged by this podcast, please help us spread the word. You can give us a review on Apple Music or Spotify and share this episode on social media.
Let us end with this prayer for town and rural area from the Book of Common Prayer. Lord Christ, when you came among us, you proclaimed the kingdom of God in villages, towns, and lonely places. Grant that your presence and power may be known throughout this land. Have mercy upon all of us who live and work in rural areas, and grant that all the people may give thanks to you for food and drink and all other bodily necessities of life. Grant those who labor to produce them and honor the land and water from which these good things come. All this we ask in your holy name. Amen.